and welcome everyone. My name is Dr. Marina Demyanenko and I am joined by Dr. Yousif and Belinda Dimmock, and we're just going to give you a little rundown of the holiday season and some support for your fertility journey. So welcome everyone. I hope we don't take too much of your evening and that you learn something really valuable this afternoon. So the fertility trifecta, so the things that we kind of, I think, hit most in this holiday season, or the silly season as I like to call it, is a little bit of emotional, physical and financial stress. And so we kind of wanted to have a chat to you guys about this during this silly festive season, because I think that all of these things can be heightened in terms of emotions and the physical strains around this season, but also the finances get a little bit more tight around the silly season. We're going to start with our wonderful fertility counsellor and psychologist, Belinda, who's going to kind of just take us through coping with fertility during the holiday season. So welcome, Belinda, and the floor is all yours.
Thank you. Thanks, Marina. Yeah, December and the holiday season's a really testing time for many people. And a lot of that is because, infertility issues and emotions around that are really heightened during this time of year. There's often a lot of celebrations that are really focused on family and children. And then combining that with all the heightened emotions is really difficult. And we certainly see a huge increase in people needing support over that time in our counselling team. So we're going to go through each of those areas that are on the screen now tonight and just provide some strategies around these things just to help you to survive the holiday period. So a lot of emotional challenges are triggered during holidays, a lot of emotions, sorry. So often grief, either not having a child at this moment or potentially over any losses that you've had as well can really be heightened. There's also a lot of stress experience from other people's expectations of where you should be in your family planning journey. There can often be really heightened anxiety around attending all the social gatherings that we're expected to go to, whether it be work functions, family functions, friendship functions. There's a lot. And then often feelings of failure, which are already often there through the whole year, they can be really heightened as well. It might be that you're not where you hoped you would be in your life at the moment, or you might be really feeling the failure that you think your body is providing you with. And also feelings of isolation can really intensify during the holiday period as well. It could be that you feel like everyone around you has a child and you don't, or it could also be that you feel really alone and isolated because no one understands where you're at, or what you're experiencing at this time of year. So some of the coping strategies are around seeking support. If people are comfortable to speak out with their close friends or family members, that is often a really advisable thing. And again, it's being selective over who you approach and knowing that you're approaching the right people for the right issue. There might be connecting with support groups that you've found online. And it is really hard. There's nothing that we can really recommend in terms of support groups at the moment because they are all closed and the counsellors don't have access to them. But we also often find if you're quite early in your journey of infertility as well, it might be good to avoid those support groups as well because they can really escalate or heighten emotions as well that you're experiencing, because they might be much further along in their journey and their experiences. And another thing is just to seek support from professional services as well, and we'll talk a bit more about that later. So it's really good as well to establish boundaries, and that can be a really uncomfortable thing for people to do. There's often the expectation that you will attend all the events that you're invited to, but remember it's okay to decline events. If you're not comfortable just saying no or saying that you won't be able to attend, come up with a reason why. So let them know that you have another function on that night, which is actually pretty understandable at this time of year as well. It's good to consider discussions or questions that might cause you some distress and have some prepared answers to say to people as well. So practicing those responses can be useful too. And we'll talk a bit more about answers to questions that you might get soon. So self-care is also really important. And one thing I didn't put on there, but is one of the most important things that I say to people that I counsel is self-compassion. So we're often really hard on ourselves, whether it's self-talk around, that you're not coping, or whether it's around what your body's doing. So what I like to remind myself and remind people I speak to is that it's really good to treat yourself like you would your best friend or your sister or your brother or your parent. And you wouldn't often talk to them the way you talk to yourself. I think that's a really good tip to remember. And since I started practicing that probably around 5-10 years ago now, there has been a really big difference, I guess, in the way I feel. Mindfulness and meditation is also really good. Mindfulness is more about bringing yourself back into that present moment and using grounding strategies to do that. So there are a couple of ones that I have as my favorites. A really quick one is to think of 5 things you can see. So look around you and think of 5 things. Look at 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So that really helps bring you back from your anxiety and into the present moment and what you're experiencing right there. The other one I like, which uses a bit of breathing exercise as well, is the box breathing. So it involves a bit of visualization as well as breath work. So you imagine a box, whether it's square or rectangle, it's up to you. And you breathe in for 4, and you imagine the line of the box moving across the top as you're counting for 4. And then you hold your breath for 4. So you imagine that line moving down for 4. Then you breathe out for 4. So imagine the line going across, and then hold your breath for 4 again as the line goes up. So doing that for at least a minute is really helpful and can help sort of ground you in that present moment and keep that anxiety levels down. Exercise is really good for some people as well, but given where you might be at in your fertility journey too, it's good to consider that you might not feel up to it as well. So if that's one of your normal ways to cope and you're really not feeling, like you're able to do that now, again, it comes back to that self-kindness and that, telling yourself that it's okay to have a break if that's not what you feel like. But again, if that's your go-to for stress, it's really good to talk to your fertility specialist or your nurses around what you can substitute that with that's going to be healthy for where you're at in your journey as well. We get a lot of questions around that in counselling, and I'm always hesitant to answer. And I always refer it back to the specialist and the medical staff. Gratitude practices are also really good. And I know we might not often feel like feeling grateful, and it can cause a bit of resentment as well. But if you do this daily, it can be really helpful just in terms of, I guess, feeling hopeful, feeling happier in where you're at. Some of the easy questions to ask yourself if you don't have access to the internet and, can Google questions or, get a journal. It could be, what made you smile today? Or who are 3 people you're really grateful for today? What's one aspect of your health and body that you are really grateful for right now? And if you can't think of anything that day, if it's been a really crappy day, just remember something that's made you laugh uncontrollably in your life. So anything like that can be used for gratitude. And if you can use this period, might be having a break from work or taking a holiday, it's really good maybe to take some downtime in cycle tracking and all the things that can make us feel a little bit crazy or anxious, I guess, during these holiday seasons as well. So it's really important too that you communicate what your needs are to family and friends. So remember that just because it's obvious for you, it's not obvious for everyone else what you need. So choose the right time and place. So whether that be a phone call to the host of the function that you're going to before you get there, rather than waiting until you're there. Be really clear about what you need from them. So it might be that you're, seeing your parents and you don't want them to tell anyone else in the family about where you're at in your journey. Set boundaries again if you need to. So let people know what you will and won't talk about. Remember to be honest and sensitive as well. And again, I know that's hard because you feel like people should be more sensitive to you. But remember that people think they're being kind and interested and curious about where you're at in your life, and they're not usually trying to be malicious. So if you can just remember that they're probably coming from a place of goodwill, I guess, and caring about you. And also that falls under understanding and forgiving as well. That many people who haven't experienced infertility, they won't have a clue how you're feeling. And I think until people go through that themselves, it's really hard to empathize. So in terms of managing all the gatherings that you might be attending, it's really good to consider whether you are emotionally ready to attend. So before an event, just check in with yourself emotionally. So just check in and see where you're at. Do you need to do some grounding exercises? Is it going to be too hard to go? It's okay to pull out, and that's around that boundary setting and self-care. It's good to have an exit strategy in place. So something I often talk to people about, maybe a baby shower, for example, is that you can just let them know that you'll be there for half an hour. You'll drop in just to say hi and show your support. And then you have to leave and go to another event. So something like that might be suitable for some of these functions as well, where you're just showing your face, showing that, yes, these people are really important to me, but then rather having to go through all that emotion and fear maybe, or anxiety around what people will think, you can just let them know that you've got something else to attend. So that's sort of around that arrive late, leave early as well. So you can show up 2 hours late, obviously let them know first, and then leave early if you need to. And that will hopefully mean you get to avoid a lot of that small talk and have that more deeper, meaningful conversation with the people that matter. And again, prepare and practice responses for common questions that you might get. And I've got a couple of those responses coming up. And just remember, it's okay to set boundaries. A lot of people forget that. And I think people actually can appreciate having the boundaries set for them as well, because then they know where they stand as well. Okay, so responses to difficult questions. There's lots of ways you can go about it, and it really depends on your personality and how you want to come across or portray yourself, or whether you like the person maybe as well. So one of them is just to shut down the questions. So an answer to a question around family planning, it might be, I don't know, how did you predict when you had yours? So that's if someone asks when you're having children. Another one is you could dance gracefully around the issue. And a response to a question with that is, that's a really great question. I wish I knew the answer. So again, you're just giving them something, but not a lot. So you can make it humorous if you like. And there's, I like this one. So you might say, well, when the time is right, my eggs or sperm are pretty picky. So you're just sort of, again, not giving them much, but you're answering the question. And another one with the humor might be that they might say, oh, when are you having a baby? And you might say, well, I already have one, and then point to your spouse or your partner. So again, just keeping them at a bit of a distance. You could turn it back on them as well. So when they ask, you can say, I'm not sure, what do you think? And, get their response to that. And the last one would be that you might want to educate them. So one example of that might be that you say, some people do have a really hard time getting pregnant, and questions like that can be really hard for them and make them feel bad about the situation. So again, they all depend on really, your relationship with the person that's asking. Okay, so another thing you can do during this holiday season is create new traditions that maybe don't bring up that emotion or heighten that emotion and intensity. So it might be that you explore new ways to celebrate the holidays. So if you're normally around all your family and friends and young children, maybe you want to look at going on a holiday during Christmas where it's just about you and your partner. Or maybe you go to a nice restaurant instead of a park. So an adult retreat maybe. So there's lots of different options you could choose that might be different to what you're used to. It might be that you decide to do some volunteer work and give back. And that's a really good way to distract yourself, as well as feeling like you're accomplishing something really good if other things in your life aren't going so well. And maybe arrange a gift for yourself. So prepare something that you can really look forward to this Christmas or this holiday period. So seeking additional support. So we often find when we do the IVF counselling that people don't always want to confide in their family and friends. They might want to keep their journey very private. So we do have our counselling services available at Melbourne IVF. And that is there as part of your fees as well. But that is a short care that just sort of helps specifically with emotions related to your infertility journey. Sometimes it can be really good to establish, I guess, a longer term and more regular arrangement with a private psychologist or counsellor. And that can be done through your GP and via a mental health care plan where you can get Medicare rebates as well. So again, maybe use the break over Christmas that you might have from work to maybe seek out some support if you feel you might need it. And that was it. Thank you.
Thanks so much, Belinda. I really like the humorous ways that we can deflect some of the questions that we don't like this holiday season. And so I thought that I would hand the mic over to Yousif, who would just start us off about preparing for your fertility treatment in the new year and how you can prepare yourself over this silly season. So over to you, Yousif.
Well, thank you, Marina, and thank you, Belinda, as well. Definitely, the fertility journey can be difficult and a roller coaster. Definitely seek out if we can be of any extra support. And I like some of the responses there, Belinda. Definitely taking some notes. So I'll cover the next few slides and then I'll hand over back to Marina. You might be questioning why you're not falling pregnant, but actually difficulty conceiving or infertility is quite common. Here in Australia, on average, roughly about 1 in 6 couples might have difficulty conceiving and might need some help in order to achieve a family. Slides will change soon, just on the slow burner. Here we go. And so what are some of the common causes? And a lot of the time, the female partner gets blamed, but I like to think fertility is in 3 parts. We need an egg, we need a sperm, and we need a place for them to meet. So we could have an issue releasing eggs, for example. That's your ovulatory disorders, which is the most common under female infertility. For example, you might have heard of something called polycystic ovarian syndrome, which is one of the most common syndromes we see, where there is difficulty releasing eggs or ovulating. Or you might be ovulating, but the egg and the sperm can't meet because the tubes are blocked. It could be because an infection you've had in the past, such as STIs, it could be a surgery that you've had in the past that caused some adhesions, or it could be endometriosis. And on the other side, in terms of male infertility, it contributes to roughly about 1 in 3 or up to 50% of couples, there might be a male factor component as well. And that could be because of a production problem, like there's an issue producing sperm, whether that's because of, I call it the factory, the testes, there's an issue with the factory itself that's not producing sperm, or maybe the factory is not receiving the right signals from the brain. That's the central cause there on the list. Or the factory might be fine, it's functioning, it's producing sperm. It's just the sperm can't leave the factory because there's a blockage, there's an obstruction somewhere. And that's your outflow obstruction. It could be, again, because of an infection you've had in the past. It could be because of surgery. Or sometimes the tube that connects the testes to the outside, which is the vas deferens, could be absent. And some people are born with an absent tube. And one of the common conditions that causes is cystic fibrosis. And could be other reasons as well. It could be a hormonal problem, could be issues with libido, erection, ejaculation, and sometimes the sperm or your body form antibodies against sperm. And the antibodies are like little bees that can make the sperm stick to itself. So it might not be able to swim, or it might not be able to get inside the egg to fertilize it either. And there's a whole raft of other conditions from both male and female. And we haven't spoken about the uterus, which is the other big part. You could have things like polyps, which are like skin tags that go inside the uterus. It could be fibroids, which in my head, I like to think about a fibroid like a knot in the muscle of the uterus. And if it is large enough, it can distort the inside of the uterus and affect the embryo implanting. And there are other issues as well. The slide to go again. There we go. Age is definitely a factor, and sometimes we don't speak about it enough, but age does affect male fertility as well as female infertility as well. So as a male ages, it can reduce their sperm count, it can reduce the sperm morphology, and can affect the sperm quality as well, or morphology. And from a female point of view, you're born with all the eggs that you'll ever have. You probably heard that term said many times before. And on average, roughly you're born with 1 to 2 million eggs. And by the time you hit puberty, the number is already down to about 400,000. And you start to lose more eggs as you get older. Each month, you only release one egg, usually. Sometimes you release more than one. That's how natural twins happen. But the reality is you have these waves of eggs that grow all the time. So I call them waves. And out of this wave, one egg will hatch and the rest will kind of disappear. And this happens throughout your life. And the size of the wave depends on your egg reserve or how many eggs we have in the basket. Some women are born with more eggs than others. And sometimes during your lifespan, things that can happen to you or to your body that affects your egg reserve. It could be because you've had surgery in your ovary, for example, to remove a cyst or endometriosis that can reduce your egg reserve. Or maybe you had some medications like chemotherapy that can be toxic to your ovaries and can reduce your egg count. But this is mainly about the quantity, but also the quality of the egg can get affected over time. And if we have time at the end, we can go through a bit more details. I'm just cognizant of time. I'll move to the next slide, and if you think of questions, please write them down, and we'll cover them towards the end. Here we go. So what can you try at home before you come and see us or see your GP? One of the important things is to focus on your lifestyle. Make sure you optimize your lifestyle, be the healthiest version of yourself you can be. There can be things in your environment, whether that's home or at work, that you can modify. Especially as a male. For example, if you work in a place where there's high exposure to heat, heat is the enemy of the sperm. If you're exposed to things like herbicides, pesticides, chemicals, heavy metals, all of these things can be toxic to sperm and egg, and you want to minimize those exposures. And stress, like Belinda told us earlier. So find ways to manage that stress. You can see your trusted GP or your fertility specialist or gynecologist to have a pre-pregnancy or fertility check. That could be after you've tried for some time, or if you're worried at any stage. You don't need to be trying for a year or 6 months or whatever number of months before you come and ask for an assessment. I would say if the question comes to your mind and you're worried, go and get that checked. And I'll cover this in a couple of slides, but it's really important to understand how the menstrual cycle works. When is the fertile window? Because we want to make sure you have sperm there waiting for the egg, not the other way around. If the egg hatches and there's no sperm waiting, the egg is gone. So general health, it's really important to be the healthiest version of yourself, as we said. Body weight is very important. Make sure you monitor your lifestyle. Smoking, big no-no for both men and women. Smoking can be toxic to egg and sperm. In terms of alcohol, we don't know if there's a safe limit in pregnancy. And caffeine, I think both Marina and myself will agree. I can't say give up your coffee. Do enjoy your one cup a day, but don't drink excessively. A couple of cups a day is fine. 1 or 2 shots a day is probably fine. But excessive caffeine can be associated with increased rate of miscarriages. But do enjoy 1 cup a day. In terms of drugs or medications, if you're taking medications for other health conditions, just have a chat with your GP or your specialist, because some of those drugs or medication might not be safe in pregnancy, and they is usually a safe option, so they can switch you to a safer option in pregnancy. And in terms of steroids, or especially testosterone as a male, if you're taking steroids or testosterone, that can actually reduce your sperm production. So it's really important to let your GP know if you're taking steroids in the gym or taking testosterone. Sometimes you think if you take testosterone, that will boost your sperm production. It actually does the opposite. Your sperm production can go down to 0. So what kind of test might you expect if you go and see your GP or come and see one of us? In terms of assessing female fertility, we do a couple of tests to check your egg count or your egg reserve or what's the size of the basket. AMH is a hormone. It's called anti-Mullerian hormone, and it's produced by the little resting eggs on your ovary. So the more resting eggs you have, the higher the hormone. The lower the resting eggs you have, the lower the hormone. it's a bit nuanced. There's other things that can affect your AMH results. So if it comes back as low, and then don't hit panic buttons just yet, come and have a chat with us and can explain why that might be the case, and it might not be a true reflection of your egg reserve. And the ultrasound scan is the other thing that we do. And ultrasound scan is very valuable when it comes to assessing female fertility. We do look at your ovaries. We have a look at the number of resting eggs in your ovary as well with ultrasound scan. But it can also assess the uterus, which is the other big component, to make sure it looks normal, it has a normal size, there's no other pathology there like a polyp or a fibroid. And it can also assess the tubes to see whether the tubes are blocked and swollen. We can also assess to see if the tubes are patent. So if they want to check the tubes are blocked, we need to add an extra test to your ultrasound scan where we just push some fluid inside the uterus and see if the fluid comes out the other end. So it's not part of routine ultrasound scan, but it can be done at the same time. We can also do tests to confirm ovulation, and usually that's a blood test. And it's called progesterone, which is another hormone that your ovary will only produce after ovulation. And generally we do it a week before you expect your next period to come. If you do it too early again, it can be negative. It might cause more stress. You think that you're not ovulating. So it's really important to do it at the right time. And we do general screen pre-pregnancy for both partners. That could be infection screen, HIV, hepatitis, syphilis, all of these things, STD screen. And for the female partner, we also check that you have immunity against rubella and chickenpox, which is really important before pregnancy. And for the male partner, the biggest test that we do is check your sperm count to make sure the count is normal, the movement is normal, and the shape of the sperm is also normal. Sometimes we add sperm antibody tests. That's an add-on. Not everybody needs it. And it's really important to let us know if you have history that might have an impact on your sperm production. It could be because you were born with these undescended testes and you had surgery as a baby or as a child to bring them down. Even though you had surgery to bring them down and they might look normal now, they don't tend to function as well. Or if you've had infection in the past. As a kid, if you had an infection with mumps, it can affect your sperm production. And if you're old and had a genital infection, it might cause an obstruction. So you might be producing sperm, it just can't get out. And the same thing we'll do infection screening like hepatitis B and C and HIV and STDs. And occasionally, if we worry, there's extra added tests like genetic testing or ultrasound scan if required. So now if we do your test and the test all come back as normal, and you want to try for a little bit at home, what can we do? Cycle tracking is a common way to try and find out when is that fertile window, when should we kind of focus our efforts, so to speak. And on that graph is that purple rectangle. And if you look at where ovulation happens, I don't know if you can see my arrow that says the day of ovulation there. Before you ovulate, as the little egg grows on your ovary, start to produce more a hormone called estrogen, and that's your blue line. As the estrogen goes up, you might notice changes in your body, like increase in that clear discharge, for example. And then at some stage, your brain will send the signal for the egg to hatch. And that signal, which is that purple line as it goes up, that's your LH surge. That's what your ovulation kit will detect. So it tells you your ovulation will happen soon. It's time to get busy. It's time to have fun, especially over the holidays. And when you know when you ovulate, you want to be having intercourse in the days leading up to ovulation. You don't need to save up for the day of ovulation. The 5 or 7 days leading up to ovulation is usually what we recommend. And to pinpoint ovulation, could be a blood test, could be ultrasound scan, or it could be the ovulation kits that you do at home. So a few tips. Yes, you don't need to save up for the day of ovulation. Sperm can last inside for up to 5 to 7 days. And ovulation tracking in itself can actually be quite arduous and stressful. You don't need to track your ovulation. You can do it a few times just to get to understand your body and how the cycle works. But if we think of this fertile window of the week leading up to ovulation, if you're having intercourse regularly, 2 to 3 times a week, twice during the week, once over the weekend, you will cover the fertile window. So you don't need to specifically check for ovulation every single month. And the trick is to keep going, because not most couples won't fall pregnant after the first month or the second month. So if you take 10 couples who have all the tests are normal, about 8 out of 10 will fall pregnant within the first 6 months or so, as long as everything is fine and the female partner is ovulating every month. If we wait for up to 2 years, 1 out of the 2 couples that haven't fallen pregnant within the 6 months might fall pregnant, and there will still be 1 couple, even after 2 years, that haven't fallen pregnant. And they might get lumped under this category of unexplained infertility if everything else has come back as normal. And if we have time at the end, we can talk about that a bit more as well. So just a few key points if you're trying to conceive at home, or even if you're doing fertility treatment. Again, that message over and over again: be the healthiest version of yourself you can be, and that's for both partners. It's really important to take your folic acid for the female partner. And if you live in Melbourne, take vitamin D. Don't check it. Everyone has low vitamin D. We don't get enough sunshine. And if you go out, you always have sunscreen on. So definitely vitamin D, your folic acid. And if you read about fertility supplements, you'll be inundated with all these options. And most of them don't have evidence behind them. One of the common ones you might hear about is antioxidants. Antioxidants are helpful. They help with the quality of the egg and the sperm. My personal preference, you get that through your diet. You can eat your berries, your citrus, your colorful vegan fruit, and nuts. Nuts have zinc and selenium, which can be helpful, especially for the sperm health. My preference is to get that from your diet rather than a tablet. And if you're worried at any stage, go and have a chat with your GP, with your fertility specialist, with your gynecologist. And especially if you have health conditions that you think might have an impact, come and have a chat with us sooner. And it's really, really important there, if you've been trying for some time, or if you're worried, come and have a chat. But how long is too long? How long should you wait for? The general recommendation, if the female age is 35 or below, you can keep trying at home for up to a year. If the age is more than 36, after 6 months, we recommend that you come and have a chat. That doesn't necessarily mean we need to start treatment immediately. It's just so we can dot our I's, cross our T's, and make sure we're not missing anything. We might be checking for ovulation, we'll check the sperm count, and also we do general ultrasound scan to make sure there's nothing obvious there, like a big fibroid or major issues with the uterus, for example. But these are only guidelines. If you're worried, again, I know I've said this multiple times before, if you're worried, that's the time to come and have a chat. So what are your options? If you've been trying for some time, everything has come back as normal, and you've come to see us, one of your Melbourne IVF Fertility Specialists, there's no one size fits all. So we always have a chat with you as a couple and try and understand what your goals are. What are your family goals? Some that come and see us, they just plan it for 1 child, for example, and they want to get pregnant tomorrow. And there's some that want to have 3 children, but they're not ready to start a family for 5 more years. So we sit down and have a chat with you and understand your background, understand your goals, understand your family aims, family size that you're aiming for, and then what kind of treatment will suit you. We discuss the range of options, and then between us and you, we work through the different options and see what do you want to try first, because it doesn't necessarily mean everyone who comes in, walks through a fertility clinic, we put them on the IVF conveyor belt. That's not the only option that we offer. Through Melbourne IVF, we offer the range of options of fertility treatment. If you have an issue releasing egg, you don't ovulate. For example, you have polycystic ovarian syndrome. It could be as simple as ovulation induction. And that's not always, doesn't necessarily mean you need injections either. That could be as simple as taking a tablet, and you take that for about 5 days each month. And that kind of tricks your brain into thinking your ovaries are not working, and the brain starts to send more signals to the ovary to force it to ovulate. Sometimes you do need injections to help you ovulate if you don't respond to it. Other options that we can try is something called intrauterine insemination, which is where we concentrate all the good swimmers, all the good sperm that's fast moving, get rid of any dead sperm, and we place it inside the uterus at the right time of your cycle. Or we could do both. We could do ovulation induction and intrauterine insemination, or IUI, at the same time. And in my head, I think we're giving the sperm a head start. And if we get you to ovulate more than 1 egg, we give the sperm more than one target to aim for. Sperm can have Y chromosome. If we're lost, we don't like to ask for direction, so sometimes we get lost. We give it two targets to aim for, you're more likely to achieve a pregnancy that way. And now we've tried everything. So what do we do now? Now I'll hand over to Dr. Marina, who will tell you what to do next. Thank you, Marina.
Thanks so much for that, Yousif. I really like the two moving targets for the sperm analogy, but I think the one thing that you hit on that really struck home is that every patient is different and every journey is different, and everyone's going to go through this experience in a really different way. And so some patients will have, or some people will have a very simple journey to falling pregnant, and the next person might have a much more difficult time. And you are all different, and you're all going to have a completely different experience of starting a family and what that family looks like. And so sometimes things don't always go as planned. Sometimes we don't fall pregnant when we want to. Sometimes falling pregnant is a lot more challenging, and sometimes we suffer from miscarriages, which are really unexplained and can be quite traumatic. And so what happens when you've been working with a fertility specialist and you haven't had any success? And I guess one of the things that I encourage all of my patients when we're not getting the outcomes that we're after to do is get a second opinion from another fertility doctor. And one of the things that we do amazingly at Melbourne IVF is we have this great brains trust of doctors, of really people that have had different experiences, worked in different countries, people that have learnt from different people. And as a result, it means that we've got different approaches to infertility and our patients. And so one of the things that we do is collaborate within our network and within our team. And so any patient that comes through Melbourne IVF, if they're having a particularly hard journey or not getting the outcomes that they want, one of the things that we do is actually present them in our complex patient review. And so we have a multidisciplinary case review where we have our nurses and our scientists and a whole group of doctors, and we discuss the patient's care and their journey so far. And it means that we can bring some new ideas and some new thoughts about how we can assist this couple with their infertility. Not all clinics obviously have that, but getting a second opinion, getting a fresh start or just a fresh set of ideas can sometimes be the thing that you need to keep you going on your journey. One of the things that you otherwise can consider is contemplating pre-implantation genetic testing. So what that is if we've gotten some embryos, we've done some embryo transfers, and you haven't gotten pregnant, or you're having recurrent miscarriages, one of the things that that can be underlying it or causing that problem is a genetic problem between the genetics of the eggs and the sperm and how they combine to form the embryo. Now, most of the time, this is a spontaneous abnormality in the eggs and the sperm. So not something that you carry in yourself, but something that's been created in that egg and the sperm. And what it leads to is an embryo where you don't have the right amount of genetic material. And so that embryo may not lead to a normal, live, ongoing pregnancy. And we can test that embryo. And so what we do is in the lab, our amazing scientists that we're always surrounded by, what they do is fire kind of like a little laser, and I try to think of like Star Wars with our laser lightsabers, but it's not quite the same. But that's kind of the picture I have in my mind when I talk to my patients about it. We fire a little laser through the embryo, and then we take a small biopsy to remove a small group of cells, and we send those cells off for genetic testing. And what we're looking at is, do those cells that we're looking under the microscope have the right amount of genetic information? And what this kind of testing can do is it can reduce the time to pregnancy, not necessarily improve your pregnancy outcomes, because eventually we would have put back that normal embryo as well. And one of the, I guess, other options that we've got, if we're finding that for whatever reason, the egg quality or the sperm quality is just not working for you guys, is that there is always access to the donor bank, okay? And that can be donor eggs, donor sperm, or donor embryos. And sometimes for our patients, especially at extremes of age, or a lot of my patient population that have got premature ovarian insufficiency, this might be their only option of starting a family. So there are, I guess, other alternatives that we can look at. And your fertility specialist is a really great first point of call for that information. And they can kind of talk you through the steps and whether it is time to move on to some of those additional steps at wet pace. Now let's see if I've got control of the slides. Perfect. The other thing I like to tell my patients is that IVF or fertility, the fertility journey it's a marathon. It is not a sprint. And so we all know that IVF success is cumulative. So if we're looking at patients kind of under the age of 35, 60% of couples will achieve pregnancy after 3 IVF cycles. That also means that 40% will achieve it within their first cycle, but just because your first IVF cycle failed does not mean that this is going to fail for you. It just means that you need to keep going and try to keep going on this journey, because this is a rough journey. This is an uphill battle, but it is a cumulative success rate. And obviously you can see the statistics as we get a little bit older, because they do become a little bit harder with advanced age. So should we try alternative therapies? So I guess this is a question I get asked a lot, and lots of people out there that are spruiking the next multivitamin, the next best thing to improving your egg quality, some hormones that you can add on. What things can we add on that will improve the outcomes? And actually the current research does not support these alternative treatments. So it kind of suggests that at this point, and then I caveat it at this point because science is an ever advancing thing, and we're learning so much every day about fertility, and we're trying to improve fertility outcomes in our patients, and we do this all the time. But at this point, a lot of the alternative therapies don't improve your fertility, and they don't improve pregnancy rates, okay? And so a lot of these things are a little bit experimental. They're trial and error. And at this point, there's not a lot of evidence to say that they have a positive outcome on your fertility journey. However, anything that improves your health and well-being and improves your mental health and reduces stress can have a positive impact and potentially increase your chances of success. So when I talk to my couples about this, I say, if you want to go on a holiday, great, that'll be great for your mental health. If you want to try to reduce your stress at work, that's actually going to be great for you overall, not just for your fertility journey. And so there are obviously things that we can do in our everyday lives that are not necessarily alternative therapies, but that can have a positive impact on your life and your chances of pregnancy success. So what are some of the practical things that we need to consider before contemplating fertility treatment? The financial aspect of fertility treatment is a really big thing for most couples, okay? And it's a really big thing for anyone trying to start a family, sorry. And the silly season really brings out those financial pressures that we all experience in our day-to-day lives. So some of the tips that we've got for you is joining your and your partner's Medicare cards to optimize Medicare rebates and safety net thresholds. And this isn't something I didn't know about before this talk, so I think this has been a kind of a great adjunct even for me. There are other ways that you can pay for your fertility treatment. So Afterpay, Zip Money, or small loans to fund your fertility treatment are an option for those that are struggling to make ends meet and actually be able to afford some of the treatments that are available. But as Yousif said, it's not always IVF. And so some of these fertility options that we discuss with you as fertility specialists are not going to be costing you thousands of dollars. Lots of couples get pregnant prior to IVF, and we need to make sure that you have the correct information and that you're actually seeking guidance and advice prior to that. Because if IVF is your only option, great. But if it's not, the journey can be less financially burdensome than you think. There's also options to release super to fund your fertility treatment on compassionate grounds. And so we've got a really great patient care team that can guide you through your journey if this is something that you want to explore. It's also really important to get an understanding of what your private health insurance does and doesn't cover, and whether or not it covers fertility treatment. Most private health insurance actually only covers your day hospital and your anaesthetic fees, and most of the other fees associated with IVF are not covered by private health insurance. And so if you're looking to fall pregnant and getting private health insurance just for your fertility journey, I wouldn't run out and spend all of that money just yet. Make sure that you're looking at the fine print when you're looking at your private health insurer and whether or not they're going to assist you at all. What are some of the practical things that we need to look at? Because it's not just about the financial things, but it's about some of the personal aspects of our fertility journey. And I think it's really important that you do some research and that you educate yourself about your options. But it's not just about your options in terms of treatments. It's about your options of providers. It's about your options in terms of who you feel comfortable seeing and where you want to go for your treatment. You can talk to your family and friends that have gone through an IVF journey, but also speak to family and friends that have maybe got friends that have gone through this fertility journey. Talk to them about what their experience is, what they really appreciated in their fertility journey, and what were some of the downsides, what were some of the kind of the roadblocks for them in their fertility journey, and how did they overcome those. We always recommend that you look at social media, because there's lots of social media about fertility journeys out there. Watch Big Miracles on Channel Life and have a look at the different patient journeys, because every one of you is completely different and your journey will be different to the next patient. And it's kind of great to get an understanding of what there is out there and what journeys look like from a fertility perspective. There are so many podcasts. I guess our new society and our new generations, we're so exposed and we are so connected online, and we've got so much access to fertility podcasts and kind of reliable medical information. But I caveat this in saying that there's so much unreliable medical information out there, unreliable information about fertility journeys. So find a podcast that's given by a fertility specialist, someone that's done advanced training in their fertility processes and education and medicine. Find someone that is not just giving you their opinion, but actually has some education and medical knowledge behind it, and listen to the information that they provide. And we've got a lovely podcast that's called Fertile Minds that will give you some information about fertility, but also some gynecological conditions that may affect your fertility as well. I always talk to my patients about creating a network, and Belinda said this really well earlier. Some of us feel really comfortable talking to our family and friends about our struggles and our difficulties falling pregnant, but some of us are quite introverted and we like to keep our things that are personal close to our heart. We don't want to talk to people in our family circle, our friendship circle about it. So there are online support groups that can be really great for patients that want to seek advice and support, but not from people that they know. And so we can definitely get you in touch with some of those support groups. Again, it's a little bit of a hit and miss. Sometimes these support groups are really great and really informative, and at other times people in these support groups might be somewhere further down their journey than you are, and it can be a little bit more distracting. So you are the best person to decide what you need in terms of support for you. Seek your GP and talk to them about a mental health care plan. I talk to all of my patients about fertility being a difficult journey in terms of mental health, but actually I don't look at just your fertility journey. We know that if you have mental health concerns in the background, that pregnancy and the postpartum period can also be a really difficult period from a mental health perspective. And so setting up those supports, having someone that you can call on, whether it's a psychiatrist or a psychologist or a therapist that you work well with, when you are at those points of need, is a really good thing to set up before you have a baby. And then what are some of the practical things? I think that we need to have a look at our environment, and we have to have a look at our workplace, because gosh, we spend so much time in our workplace at the moment. It's no longer a 9-to-5 environment. A lot of us are working more than full time. And so a workplace is a really good thing to have a look at to see if it can help us with our fertility treatments. So some of us obviously feel comfortable talking to our employers or trusted colleagues that may support us in our journey. But actually, some of us may not. And so it's really important to understand the fine print in your company. What is your leave policy? Do you get paid maternity leave? Do you get bereavement leave? What does your sick leave look like? It's really important to understand that actually for most workplaces, you just have to tell them that you're sick. You don't need to tell them what medical appointment that you're going to, or what particular treatment you're getting, or why you're having surgery. That's kind of information that you can give if you'd like, but it's not something that you legally have to. There may be some additional leave required for procedures or for you around your treatment. And so it's quite important that you talk to your fertility specialist to get a really good understanding of how invasive is this process? What days do you require off work? Can we work around your work schedule? Because a lot of us have start quite early in the morning and we might be able to scan you before your work schedule. So actually we're quite flexible in terms of working around your work schedules. And can you organise flexible working arrangements that best support you? I think COVID's done one very good thing for us. It hasn't done much, but working from home is one of the wonderful things that we've gotten through COVID. And I think that if you can, in preparation for that fertility journey where you may have to step out for some appointments, try to create a working from home environment at least some of the days. This may be able to allow you to attend these appointments in some sort of degree of privacy. But don't forget, you're not alone. And as Yousif said, 1 in 6 couples will suffer with fertility issues. And there are people and services that can help you on your journey. We're here to see you. We're here to help you. And you are not alone in this journey or over this silly season. So just kind of summing up for you guys, we talked about the fertility trifecta. Belinda covered so well the emotional aspects of suffering with infertility. Yousif did a really good rundown on the physical, but we totally do understand that there are financial pressures that are coming into play with your fertility journey. The important thing is to educate yourself and to make sure that you are aware of the options that you've got available to you. I guess this is the point where we kind of open up to you. And if you guys do have any questions, you can post them in the chat and we can answer them for you. Oh, someone's asked, so how do I organize genetic carrier screening? So genetic carrier screening is a blood test or a cheek swab that is an optional add-on. So it's something that you can organize prior to starting your fertility journey. And generally there are 2 ways that you can organize genetic carrier screening. You can have a chat with your GP. They are a really great first point of call to understand not only the options that are available, but whether this is a test that you actually want to have done. The other option, and obviously one of the aspects that not all GPs feel comfortable about talking, is genetic carrier screening. So a lot of the patients actually come and see me and I have a chat to them about their genetic carrier screening options and what is available and what they should do. This might be a question for you, Belinda. There's a question about how do they seek fertility counselling?
Is it within Melbourne IVF or is this open to
I guess probably from both aspects, like how can they seek support through Melbourne IVF, but also if they haven't quite commenced their Melbourne IVF journey yet.
Yeah, so look, if you're already part of Melbourne IVF, you might have consulted with a fertility specialist or you're registered. There's lots of different ways to seek contact from our support team. So it could be that you're speaking to your nurse or your fertility specialist, even reception. If you just call our general number, they can organise support for you as well. So that's probably the easiest ways. Just really anyone you have contact with at Melbourne IVF know how to book you in. If it's external, I was just thinking there are, I guess we're part of a group called ANZICA. So people who are qualified by ANZICA, which is ANZICA. You could always Google ANZICA qualified counsellors, and that will be someone that does specialise in fertility counselling. Otherwise, you could just, I guess, Google or see your GP, and they might have people that they can recommend that specialise in fertility support too. A lot of fertility counselling is around managing anxiety. So even if you're, if that's what you feel like your problem is, even someone that specialises in anxiety treatment can often help. But otherwise, ANZICA qualified counsellors are probably the best way to go.
Perfect. So that's kind of the end of the questions that we've got so far. Oh, there's a different one. Sorry, another one for you, Belinda. Do I need a GP referral to have counselling?
So GP referrals will essentially get you the Medicare rebate. So if you don't have a history of mental health issues and you're happy to pay sort of the private fee, you definitely don't need a GP referral. It's more that, you know, if they can say that, yes, we can understand you're anxious or there's a bit of depression there or some maybe preventative counselling, they can write a referral for you, which means if it's someone that is Medicare, I don't know what the right word is, but if they qualify to be able to give Medicare refunds, it means you'll get somewhere between about $80 and $120 back per session, depending on whether they're a counselling psychologist or a clinical psychologist. And I think even social workers have some Medicare rebate systems as well. But you definitely don't need a referral to access support. It just means you'll pay a higher fee. And within Melbourne IVF Counselling, if you're part of the service already, you don't need any referrals.
Perfect. And I guess on that, and we do recommend you get a GP referral to see a fertility specialist, and it's for the same reason. So you don't have to have a referral, but in order to be eligible for Medicare rebates, a GP referral is required. Perfect. So I think that's us all done for this evening. Thank you very much for joining us, and happy holidays to everyone. Thanks, Yousif. Thanks, Belinda.
Thank you.
Thanks, Marina.
Bye, everyone.
Bye.